So, welcome to this interview that we are going to be having with our newest endocrine surgeon in town, Dr. Subiksha. Um, Welcome to this interview. Before we start, I must express my congratulations to you on making through and getting a seat in the INISS exam. Very prestigious seat, I must say.
Good
Um,
evening, sir.
Good
Thank
evening.
you
Good
very
evening.
much, sir. It's a
Yes.
privilege to be able to talk to you, sir. First of all, thank you very much, sir.
Yeah. So before we begin, can you just give us a small introduction about yourself, where you did your undergraduation, where you did your post graduation, what you are currently doing, before we get into the depth of the interview?
Sure, sir. I'm Dr. Subiksha Annamalai from Chennai, sir. I did my undergraduation from Madras Medical College, sir. The first clinical posting I attended during my undergraduation was general surgery, sir. I was extremely fascinated by the OT environment, the feel of blood on gloves, and my HOD once told me that a surgeon should also be a physician because we get access to both the stethoscope and the scalpel, but a physician can never be a surgeon. So all this persuaded me to take up to dream of a future in general surgery, sir. So just as soon as I finished my MBBS, I was able to get through my first NEET attempt, sir. And then I did my MS General Surgery from Government Kilpak Medical College, Chennai, sir. So I just
Fantastic. So
completed my
you've been predominantly in Chennai only.
yes, sir. In fact, my entire UG and PG got over within a 10-kilometer radius, sir. My
Oh,
KMC is just 10 minutes away from home, sir.
okay. Okay. Great, great, great. So when did you finish your MS? Are you fresh out of MS or?
Yes, sir. I'm fresh out of MS. I just finished this October, sir.
Okay, so this is one very interesting question that is there in my mind. I'm sure it is there in a lot of our INI and NEET aspirants as well. So, what is your take on going for the exam fresh out of MS or taking some time off to prepare and then giving the exam? What is your take on this, and what was your experience?
Sir, I feel the first attempt is always the best attempt, sir, because we do not have any pressure behind. Because if we fail in the first attempt and trying to give a second one, there'll be a lot of pressure in the back of the mind that this is the only way out to get out of this rat race. But for me, I didn't have any of that kind of a pressure, sir. But there was always a plan B. If at all this attempt fails, I knew that I could take some time out to prepare. Even for NEET PG, I did not have a dedicated duration to prepare. So, my NEET PG exam was the very next day my internship got over, sir.
Okay.
So even that was a very fresh attempt, sir. I didn't have a separate duration of preparation, and I felt for the NEET PG, a lot of things which I learned during my internship was very useful, sir. A lot of clinical stuff were very useful, sir. Similarly, for my MS exam, since my MS exam got over on the 30th of October, sir, the INI exam was on November 22. So there was about around 3 weeks gap, sir. So the theory was relatively fresh. So we had extensively prepared from standard textbooks for the theory and
Did you
practical examination.
So my question to you is, did you start preparing for your super specialty during your MS training itself, or was it something that you didn't do during the PG period and that was something you thought of later? How did you go about planning for this?
So somewhere midway during the 3 years of residency, sir, first year I couldn't think of going back to books, sir, because it was very hectic. In our college we have only 4 units, sir, so we get back to back duties. So somewhere during my early second year, I decided that I personally wanted to learn the subject from standard books because I thought that only if the mind knows, you will be able to find out and pick up the diseases, diagnose better, and I would feel confident as a surgeon, sir. So somewhere during my early second year, I started reading standard textbooks, sir. And I personally wanted to finish super specialty also as early as possible, sir. So it was kind of a dual approach, sir. I wanted to learn from standard textbooks, also from I wanted to prepare for the specialty exams also, sir. So both of this went hand in hand, sir. So there was nothing. It was not a separate preparation for the super specialty exams as such. I learned mainly from Bailey, Sabiston, and Schwartz, sir. Bailey, we have to study both for our MS exams. We'll have to study from cover to cover, sir. So I've studied almost it entirely.
So you,
The Sabiston and Schwartz, selectively we'll have to study, sir. I think this approach
okay.
should be better, sir. And especially once we see a case and we learn that we'll try to retain it better, sir.
So
So I think
you're basically saying that it's better to prepare or rather start preparing side by side, especially if you're looking at super specialty. As and when you
yes, sir.
go through the course, you feel that it's better to start preparing for your super specialty exams also.
Yes, sir, it gives us a dual advantage, sir. Even during MS period, we will know better. We'll be able to pick up signs and we'll be able to diagnose better. It would, sir, once we know the theory, the content, it gives us a different level of confidence, sir. It simultaneously helps with our competitive exam preparation also, sir. So it's advantageous for us in both ways, sir.
Fantastic. In fact, you'll be very interested in knowing DocTutorial has its own surgical residency program. So
Residency.
we've got people who are joining in right from first year MS general surgery, and they are kind of traveling with us throughout the period of general surgery, and I think eventually that's leading to a lot more people being facilitating easy preparation for super specialty also.
Yes, yes, that's a very good
So
attempt.
why endocrine and breast surgery? That's very very I mean, I'm very proud that somebody's chosen endocrine and breast surgery, relatively newer specialty. uh, I must say now it's a little bit more popular than what it was, but a relatively newer specialty. Not very, not many takers. But how come endocrine and breast surgery? What was your thought process and reason behind that?
So to be very honest, I had a very difficult. It was very difficult choice for me to select the field of super specialization, sir, because surgery as such excited me, sir. Whichever subject I studied, I used to like them. I was very much attracted towards vascular surgery, urology. I found it very difficult to decide on the field, sir. But somewhere during the course of MS, I realized there's a need for organ-based specialization, sir. As an amateur first year postgraduate, I wanted to take up surgical oncology with the thought that it would give me an autonomy to operate virtually on all parts of the body, sir. So wherever there's a cancer, we can operate. A plastic surgery PG casually told me that very soon we'll have a separate surgeon for the index finger, middle finger, and the ring finger, and so on and so forth, sir. That's when I realized I'll have to narrow down my specialization and focus. Instead of knowing everything about something, something about everything. I should know everything about a particular organ, sir. A very dear colleague of mine once suggested that maybe you should think about endocrine and breast surgery, sir. That's when I knew a field of such existed. And sir, the first video I saw was your interview. It was an elaborate 1 hour long interview which you had given when you were a endocrine surgery resident, sir. That completely changed my outlook of the subject, and that was when I decided that if I had to do super specialization, and it was going to be in this field, sir. So the versatility the field offers, being able to operate on the neck, the breast, the being able to do minimally invasive procedures, be it in the abdomen and even the thyroidectomy, minimally invasive video assay thyroidectomy. It was very fascinating, sir. And maybe as a female surgeon, it would give me an added advantage. I kind of perceive that too, also, sir. So I now at present I can't think of anything else, sir. Despite the fact that a very limited number of institutions offer the course and there are very limited number of seats, I was pretty determined that I'm going to take up a super specialization only in endocrine and breast surgery, sir. And somehow by God's grace, during my first attempt, I'm able to secure a seat, sir. And I should
Yes, so
thank
that's
you, sir.
something.
If not for you, if not for the resources in endocrine surgery, it would have been very difficult, sir. Your videos on DocTutorials were my prime source of preparation, sir. I
So
would have watched those 30 videos.
how did you kind of manage your preparation? Did you was it predominantly textbook based, or was it videos with textbooks? Was it grand test based? Because everybody has a different strategy for preparation.
Yes, sir.
Uh, I don't know. Very honestly, my preparation when I was preparing for super specialty was very test and discussion based, not at all textbook based. So I don't know what was your strategy. What was your kind of way of tackling this?
So mine was always textbook based and your videos based, sir. Sir, my exam got over on 30th, sir, and the exam was on 22nd. So I had 3 weeks time, sir. So the first week
Okay.
again, I had this post MS recreation phase for around 7 days, sir. So in the limited period I had, I was able to, sir. Initially, I was completely blindfolded. I didn't know which field, which platform to access regarding the resources, sir. That's when I got hold of your videos in DocTutorials, sir. They were my prime source of preparation, sir. There are exactly 30 videos under endocrine surgery, and I would have watched each videos twice, sir. Once I watch a video on a topic, I'll try to learn the subject from the standard textbooks, sir. So even while preparing for the MS exams, I had read through the breast and endocrine part from Schwartz also, sir. And Bailey also I had already read, sir. Sabiston was something which I had to cover new, sir, because since the
Yeah.
22nd edition had recently been published, sir. So I would say in short, if you ask me, my resources were your videos, Bailey, Sebastian Schwartz, sir. And for
So you
selected
were,
topics, I referred Orlo H. Clark books regarding
yeah,
adrenal vein sampling and intraoperative nerve monitoring. They had separate chapters. These were
yeah, yeah.
small gray areas which were not covered extensively in the standard textbooks, sir. So
Yes,
I
yes,
wanted to
that.
refer further, sir.
Yeah, so so you had a good strategy of, I think, using your limited time after your MS. I think for people who will be watching this interview, especially the fresh postgraduates who are getting out of MS, it's probably a good strategy. You've already read for your exam, so you
Yes,
just top up your knowledge with what fantastic material and
yes,
resource
sir.
that Dr. Tull is giving to you. I think that adds on to your whatever gaps you have, because if you compare NEET SS versus INI, I think there is a stark difference in the strategy that you're going to
Yes, sir.
follow.
Very different,
So
sir.
you must. So how was your part A of the exam? Your theory part, was it? How was the distribution like? Can you give us an idea of how that experience was?
Yes, sir. Out of the 80 questions, sir, around 55 to 60 were from core specialty, sir. And the remaining were from general surgery, sir. When the specialty was concerned, sir, the paper was relatively easy, sir. The thing was, it was all familiar topics, sir. We had around 3, 4 questions from BIRATS. And then there was questions from inflammatory carcinoma, oncoplasty. These were predictable topics, sir. But the
Yeah.
choices were very confusing, sir. We could shortlist on 2 options, but whether it is A or B, it would be a difficult option. So we needed a little bit of in-depth understanding to choose the options. So I think the topics, the videos would cover almost all the questions that were asked, sir. And a major portion of the questions were from breast surgery also, sir. Out of the if I would say out of the 60 questions from the core specialty, almost 30 were from breast, sir. So if we could cover that well, a major chunk would be covered, sir.
And what
And
about
then
theoretical versus case-based questions? How were the questions
there were a lot
framed?
of case-based questions, sir. There were unusually high number of case-based questions, sir. And then the options for it was almost open set. In fact, the first question was in men to be. There were 4 options given, sir. Nothing was given whether it is all except or which one is true. Nothing. Almost all the options seemed correct. We were asked to choose which one is the most correct option. So it was almost open-ended questions and almost a lot of case-based questions were asked, sir.
I think slowly the exams are also moving more towards a practical oriented, image
Yes,
based, case based scenarios. I think even NEET SS is moving along that line. So that's
yes, sir.
fantastic that you are able to tackle that. I think
Yes,
we try as much as possible to give you those clinical scenario, to give you those kind of difficult questions, so that you face a similar kind of scenario, so that the exam doesn't feel like it's an exam. You should feel like you're sitting in a doctor's grand test, and you should be able to confidently answer. So I think that was our motive when we designed the videos. What about part B? Now, part A, you told us so 80% was specialty. So I think that
yes.
way you would have how did doctorals give you an advantage with that, with the 80% being from the specialty? General
So
surgery you were
because
able to manage easily.
So general surgery, there are topics which are must-know topics like burns. Burns, always there comes a question from the burns topics, sir.
That's it.
And then
That's it.
trauma is very important, sir. And then we had one question from bariatric surgery. And then we had the general surgery part of Bailey, trauma, burns, and basics of the GI surgery. transplant, I think, would be the must-read topics for the upcoming aspirants. And then
Yeah,
I had subscribed for the INSS endocrine surgery part, sir. So I was able to access all the 30 videos of endocrine surgery, sir. Out of that, no questions were in the core specialty. For endocrine surgery, your videos are more than enough, sir. Nothing was asked beyond those videos, sir. In
that's
the format
fantastic.
of the videos where you would post a question, and then you would open a question, and then following which the you would brief us about the entire concept, sir, so that we can get an idea on how we will be questioned based on the topic, sir. So
Yeah,
that was very useful, sir.
more of problem-based learning. I think that kind of helped
Yes, sir.
you for your exam.
Yes, sir.
So what about part B, which is uh, the more challenging interview part? Which, to be very honest, a lot of people are very intimidated by the interview of from AIMS. So, how did you find that part of the interview? What was your experience?
I was very intimidated too, sir. And initially, I was asked to introduce myself, sir. And then they asked me why endocrine surgery, sir. And then I was asked a question on the preoperative management of pheochromocytoma and about the axillary lymph node management, sir, and what are the recent advances in axillary lymph node management, sir. It was a
All
panel,
right.
four examiners were there, sir. It was a panel of four examiners. And it went on well, sir. But post the interview, I was not unable to assess my performance, sir, because I didn't know if I had done well.
That's how it always is. You always feel like you've
Yes,
not
sir.
done very well. In fact,
Yes,
last
sir.
year candidate who cracked the INI through DocTutorials also felt the same. In fact, he felt he will not make it, but he made a fantastic job and he got the seat of his choice. So, like what you said, I think our mock interview session also was aimed very
Yes, sir.
specifically at this. We were very clear that we'll give you problem based questions. What are the general stuff that you are? Sometimes it's very interesting that you prepare a lot for the interview and then you go there and you get asked about what
Exactly,
is your
sir.
research and what is your thesis and those kind of things. So
Yes,
it's not only important to prepare your subject; it's also important to prepare your background,
yes,
your
sir.
research, your publication. Did they ask you anything of that sort?
No, sir, they didn't ask me, sir, but
Mm.
I had something prepared for that also, sir.
So that's fantastic. I think that's a very good thing that this system of having a mock interview really gives you that confidence and gives you that boost
Yes, sir.
to go ahead and be confident in an interview.
Yes, sir. And your interview was very elaborate, sir.
We tried to cover everything. Actually, it's a little difficult to cover everything. Predominantly, we just want to give you an idea as to what areas, like for example, like as you mentioned, axillary surgery is the in thing now. All the trials on how to conserve the
Yes, sir.
axilla, how to de-escalate axillary surgery, not to do surgery in the axilla at all. So these are all newer things that are coming, and that's something we were expecting that it's going to be asked. And of
Yes, sir.
course, PO, Cushing's, these are all standard things which they want to test your basic clinical acumen and practical things of how you're going to manage. So I think you've done quite well in the second part. Also, that's probably why you've managed to get rank number 3.
Yes, sir. When I
So
was answering the question on pheochromocytoma, sir, the slides of your videos were just running in my mind, sir. So the first thing you told us was fluid resuscitation. You should ask the patient to take this much liters of water. So the slides were just running behind my mind, sir. So thanks to you, sir.
thank you. That's very kind words. So what would be your advice to anybody who's starting their preparation for an INI exam, especially endocrine and breast? What would your,
Yes, sir.
if at all, if you would want to give them a concise advice, how would you want them to go about it?
So first of all, I would say it's a very interesting field, sir. I am completely new to the field, but once we start learning the fact that how the body intricately regulates all the functioning of the endocrine system is very fascinating to learn, sir. And there's a lot of field for research, and it's a developing field, and I think it would give us a potential to establish much higher in the coming future, sir. And I would say it's a doable exam, sir. It is not a very difficult exam in the first place, sir. And then the third advice would be we have resources like DocTutorials where there are proper videos which would lay a foundation on a very strong, conceptually strong foundation will be laid once we listen to the videos, sir. And I think if you could refer the standard textbooks, I think I just calculated the number of pages which I had to cover, sir, from Bailey, Sabiston, and Schwartz. It was around less than 700, 800, which is relatively doable for a medical student, sir. I think we would have we are much accustomed to learning a large volume of information. So this is relatively possible to do if if we try to put in some efforts. And it's more of a conceptual approach. Endocrine surgery involves a lot of concepts. If something goes up, another thing will go down. So apart from by blindly by hearting, if we could learn the concepts, it would be much better, sir.
Did you by any chance do practice tests, mock tests, the grand test that is being offered? Did you use them, or did you just was it just videos and your own preparation rather than a grand test approach?
I had given two grant tests from DocTutorials, and in fact, two of those questions were repeat questions from the grant test, sir. So
Interesting.
one of them I had one of the questions I had made a mistake during the grant test, sir. Then during the examination, I was able to find the correct answer, sir. So in that way, it was useful, sir.
That is fantastic. That is fantastic. So, what out of the institutions that are being offered to you, what is your priority, and where do you see yourself, at least hoping to see yourself in the next few months?
All three institutions are very prestigious institutions, sir. When I was applying for the course, it felt like a dream if I would be able to reach any of them, sir. Now, given this rank, I would thank the Almighty for giving me this rank. And then I think I'm okay with any of the three institutions, sir. I'm unable to point one big, sir. Since mine is the third rank, I think the first two of them will decide which institution I will be allotted, sir. So I'll be happy with any of the institutions, sir.
And
I'm excited to enter into the field of endocrine surgery soon, sir.
definitely, it's a very exciting field. So, what interests you more? Is it endocrine or is it breast? This is another very common conflict, not conflict actually. I should say something that's an interesting choice that you want to make. Are you more into endocrine surgery, more into breast surgery, or are you
Sir,
okay with doing both?
I
Where do
think
you
this
see
is a
yourself?
very difficult. So this is a very difficult question for me to answer, sir. But if I have to choose an option, I would say I'm more inclined towards breast surgery, sir.
Okay, that's a very in fact that itself is a Pandora's box. What you
Yes,
mentioned was very true. We are moving towards an organ-based field now. So breast itself is
yes,
becoming a standalone specialty. In fact, a lot of people doing breast
yes,
surgical oncology, plastic, general surgery. Some places even gynae do breast endocrine surgery. So it a lot of players in the field of breast surgery, and of course it's very exciting. You have options of oncoblastic breast surgery now,
yes,
ultrasound guided procedures. So a lot of
yes,
these things are very exciting and upcoming. And of course, research is endless in breast, and it's
yes,
it's
sir.
it's, it's the most common cancer. So that's something that you will it's going to be your bread and butter, even if you're an endocrine core endocrine surgeon. So I
Yes,
think
sir.
that's a good choice that you have made.
Thank you, sir. Thank you,
Uh,
sir.
what is the feeling like in your family and amongst your friends and colleagues?
Sir, everyone is extremely happy, sir. First of all, I would like to take this opportunity to thank my parents, Mr. Annamalai and Mrs. Niraimati Annamalai. They've been a backbone of support, sir. They've been always very supportive in every career choice that I make, sir. And I have a very good support system both at home and at my workplace, sir. And during my post graduation, my HOD madam, my colleagues, to name a few, maybe Dr. Karthik Ayappan, Dr. Vishnu, and the list is a long list, sir. All of them were very supportive, sir. So I used to go to give these examinations, medal examinations out of station, out of Chennai. So I used to miss my admission days, but they used to cover work for me. So they were very, very supportive during this course, sir. I would like to uh, dedicate this to my parents and all my colleagues and all the well-wishers who've been very, very supportive, sir. My juniors, my assistant professors, my HOD madam, all of them, sir.
Fantastic, fantastic. I'm sure they are very,
And
very
sir,
proud of
not to
you.
forget you, sir. Your resources were the prime resource that I had to prepare, sir.
Thank you so much. It's our
Completely owe
pleasure,
this to you, sir. Yes, sir.
and we are equally proud of you. We are probably as proud, or probably prouder than your parents. The fact that you
Thank you
have
so much,
come
sir.
through the part A, the part B, and then you're able to really get a seat of choice. I can empathize the feeling of succeeding in the exam with you. So we're very
Thank
proud of the fact that we were a part of your journey, and we will continue to be part of your journey.
Sure,
So
sir. Sure, sure.
this relationship is not going to end with just you clearing the exam. It's going to be a relationship for life, and we are very thankful to uh, be a part of your journey. And
Yes, thank you very much,
uh,
sir.
is there anything else you would like to? You're free to to speak. Anything else you want to say?
So when I was attempting to prepare for this examination, sir, I had seen many such interviews to shortlist the resources of preparation, sir. So maybe for aspirants like me who were searching for, to where to prepare from, I would say standard textbooks are a must, sir. Bailey, Sebastian, endocrine and breast part of Bailey, Sebastian, and Schwartz. All of them, all of us must learn, sir. And then along with that, with your videos from for endocrine surgery and a few practice tests and some MCQs, it is a very much doable exam, sir. So it's not a very difficult, it's not a very impossible task, sir. I
So
think
I think that
all
is
of
the
them will
prime
be able to
message.
help you.
A lot don't get intimidated by an INI exam. Probably it may be a little bit more easier than a NEET exam because it's very
Yes,
focused.
sir.
So you know what you want to read and you know where to read
Yes.
from, rather than being having to read the entire general surgery. So I
Yes,
think that's
sir.
a very important message that you've given. So thank you so much for spending this time with us. We're
Thank you
really
very
proud of
much, sir.
you.
It's a pleasure, sir.
Again, many congratulations to you and your family and your colleagues who are very proud of you. And
Thank you
welcome
very
to
much, sir.
Endocrine
Thank you.
Breast Surgery.
Sure, sir. Thank you. The fact that you shared me the brochure of an endocrine surgery was I was very happy to see that, sir. Because it already feels like I'm a part of the department now, sir.
Very happy to have more and more endocrine surgeons. I think you guys are the future. You guys are the messengers who's going to take the specialty forward. So thank you so much for choosing the specialty. It's very interesting. A lot of clinical work, a lot of research work, a lot of basic science work. And as you already mentioned, you get to be a physician and you get to be a surgeon as well. So that is something that is
Yes.
unique to our specialty. So all the very best. Thank you so much for connecting with us. I hope
Yes, sir.
that
Thank you for
you will.
inspiring aspirants like me to take this course, sir.
I hope you will also continue to be an inspiration. You will go forward.
Yeah.
Thank you so
Thank you,
much.
sir.
Thank you
Thank you
so
very
much.
much, sir.
Thank you.
Thank you, sir. Thank you very much, sir.
Congratulations. Bye bye.
Thank you, sir. Bye, sir.